All right. Hi, everyone. My name is Bolele Polisa. I am a presenter at UJFM. And today we are going to be in conversation with Professor Alex Broadbent. And we are going to be discussing what you can expect in today's webinar under the theme Data and Delusions After COVID-19. So, Professor will be exploring a range of issues relating to data and trust in science, especially in the aftermath of COVID-19. Professor, welcome.
Thank you. It's great to be here.
Are you well this morning?
I am pretty well, yeah.
It's a bit chilly, but I guess we're finding ourselves at home, so that gives us somewhat of an advantage.
Yes. Well, I don't think anything could be chillier than the buildings at UJ.
Absolutely. So, Professor, you are scheduled to take part in a webinar that is going to start at 1 and end at 2, and you're going to be discussing data and the delusions thereof after COVID-19. When we're discussing
Yes.
data, what exactly are we talking about?
Well, data can mean many different things. I think the context in which we're most familiar with it is as something you buy to make your phone services work. But more generally, it just means information that's been encoded in some form or another and is then transmitted. It really just means information. And in this context, what's interesting is that there's been so much data flying around in the form of numbers and graphs and estimates and models. And that's really quite different from how things have been in past pandemics and in past instances of disease, where we just didn't have the internet, we didn't have social media. And so although these things may have been generated, most of us just wouldn't have had access to those things.
Absolutely. And having found ourselves in the midst of a pandemic, the use of information or the speed in which information is transmitted alongside data is very, very vast. Now, if we're looking at data before the pandemic and data now during this pandemic, how would you say things have changed?
Well, I think people are taking a much more interest in it. I mean, as I say, previously, most of us would have just thought of data as something that, you get to make your phone work. But actually now people are sort of, actually trying to sort of analyze things themselves a bit, draw little graphs and make sense of numbers and, estimates and ratios. So I think there's been quite a big difference. I think, the actual way in which data is generated and transmitted probably hasn't changed, but people's attention to it and probably understanding as well has been quite significantly increased. I mean, some scientists are, not necessarily scientists, but some commentators don't like the fact that people try and understand the data for themselves. But personally, I think it's really good. I think that people should have a critical and a thoughtful attitude to science and should see themselves as being able to penetrate it and to make sense of things themselves. So I'm actually quite positive about how this has, influenced the way we approach data and think about it.
Absolutely. Now, there have been discussions surrounding the manipulation of data, especially under this pandemic. We've been receiving numbers regarding how many people have been affected. We've been receiving numbers regarding the death rate. And there's been conversations surrounding the manipulation of data and the accuracy thereof. What are your thoughts on this?
Well, one of the things that's become apparent is that many of the uses that are being made of data in forming policy are quite poor. I mean, Glenda Gray criticized the government for this, and correctly so. I mean, I've also said that the government's policies are not evidence-based. It's clear that the people making decisions, for the most part, appear, at least in the outcomes of their decisions, not to really understand what they're doing with data and with evidence. And that's obviously a big problem, especially when, as I say, a lot of people out there now are getting a grip on these things. One of the big problems is that what we are presented with and still presented with is these models of the way the infection is going to spread. And they look very hard to understand, but what they're actually doing is not modeling the effect of, for example, a lockdown. They're modeling the effect of a reduction in social contact. And that's the result of a lockdown. It's not an actual lockdown. So they ignore the consequences of, for example, actually, implementing some measure. They just ignore it's just whatever way you get to achieve a certain percentage reduction. So there you get something that looks like data, but it isn't. I mean, that the outcome of a model is not in fact data. It's an expression of your assumptions going in, and that's a useful thing to do. But when it gets treated as data, it can get quite confusing.
And now we've just had announcements being made by the president, and a lot of people are quite up in arms, not sure about what to expect, especially now that more people will be going to work, more people will be allowed to attend religious institutions, and this brings about the question of how data will be affected by the increased movement by society. What do you think your thoughts are on this?
Well, I'm quite optimistic. It's very hard to predict. And one thing this has taught us is that really nobody is very good at predicting. And that's just, the models that were produced at the beginning were way off. I mean, they're predicting over 1 million deaths by now. And we haven't globally in full lockdown. We just haven't had that. So we know that. I think that if you look at the graph, which is really all we have to go on at the moment as the public, for infection rates and for death rates in South Africa, it's a constant curve, which means it's a straight line on a logarithmic scale. The rate at which the rate of infection is increasing is exactly the same. And it wasn't affected by locking down. It took a certain angle on the day we locked down, which means as a consequence of what happened before, maybe 10 days before that, when we took interim measures. It could be that, it could be something else. Since then, it's exactly the same rate. And I think this is what probably Glenda Gray was partly alluding to as well. There's been no change in the rate at which the rate of infection is increasing. It is still a curve, but there's been no apparent change. It's not clear lockdown has had an effect. So I am not sure. And we'll still see an increase in, each day we'll see more cases than the previous day, because that's, what it is. And of course, deaths are going to climb because, well, they're hardly going to fall. So, I mean, we're going to see that. Whether that's a consequence of unlocking or not, in a sense, doesn't matter, because we can't stay locked down feasibly. I mean, it's not actually feasible. And we haven't even, I don't think, been in lockdown effectively. So, because there's, in many places in the country, you simply can't avoid social contact. Many people have to use shared sanitation, there's overcrowding, and you have to travel to get social grants, all of those things, food parcels. So I don't think we're going to see a dramatic change. We're going to see the rate of infections presumably continue to go up and then at some point plateau. I do not think we're going to see dramatic things. These are my personal opinions. It's actually very, very hard to form an informed opinion, because of the fact that the models are really no better than the assumptions they're based on, and those assumptions are often a little on the questionable side. So it's partly a prediction, but personally, I'm fairly optimistic. I think one would want to protect vulnerable groups, but for the rest of society, I mean, most people in South Africa are under the age of 27. Case fatality ratio under the age of 27 is pretty minuscule. So most South Africans can expect to be dead by their mid-60s, and this disease really takes off at that stage. So I don't think, in this country, and even more so in the rest of Africa, we're just not at the same kind of risk. So my personal view, based on those things, it's very hard to make an assessment without more data, which the government is rightly being criticized for not releasing. But based on those things, my view is basically pretty optimistic.
At this point, we've seen that medical facilities and institutions have been able to contain those that have been infected by the virus. And now with the lockdown, or the measures of the lockdown being reduced, what do you think we can expect, especially in the medical field? Because there has been conversation surrounding our medical institutions not having enough capacity to take on more infections. What do you think this is, especially based on the data that has been released?
I think that's correct. I mean, there's a concern. I saw a picture of a facility in the Western Cape that's been set up to deal with all these cases. It's a load of beds, but the key thing in this context is intensive care. For intensive care, you need a ventilator. Intensive care didn't exist before the invention of the ventilator, which was to deal with polio in the 40s or 50s, as I recall. I'm not aware that we've manufactured or imported large numbers of ventilators. So we have about 3,000 ICU beds, I think, in the country. I mean, obviously, if we exceed that number of serious cases, we're going to be in trouble. I think this is, again, a situation where a bit of data would have helped. I mean, I don't, it's one thing for a politician to come on and just say, oh, we've improved provision, but, that's just not really, of course they're going to say that. I mean, it's not very informative. So again, one of the things from a data perspective that's coming out of this is that really there needs to be much, in this current environment, much more sharing of information from people that possess the data. Of course, governments tend not to want to do that because it opens them to criticism, both for what they've actually done, which shows up in the data, and for their management and their analysis of the data. But, saving face is not, on part of our constitution, and it's not a national objective. So it shouldn't really interfere.
So there have also been talks about modeling to predict the spread of COVID-19, especially with the needs of the healthcare system and so forth. Can you then explain what modeling would be then in this context?
Well, I think to predict so we've modeled the spread of the disease as carefully as we can on many occasions. Generally, we haven't modeled the effect on healthcare systems to anything like the same extent. We do not see, we saw a 10-minute space being given to the modeling consortium to explain their models. They're modeling the spread of the disease. There's no such thing being done, or at least being publicized, for what's going to be the effect on healthcare systems, and it's not fully included in that model. So there are now efforts to model the mortality burden of measures taken to counteract COVID-19. I've seen there's one published quite recently. So those things are being done internationally. I don't think we've got anything particularly in South Africa. It's something I'd like to do. I've got a project where we are actually trying to do that. But it's not easy without the data about, for example, how many people are now staying away from hospitals. People are coming off their HIV treatment because they don't want to go and get it for fear of getting COVID-19. That kind of thing. So it would be possible and desirable to complement the models we got of spread of COVID-19 with models of the readiness of the healthcare system, the impact on malnutrition, and various other health-related outcomes. But there's been no detailed attention to the same level as detail as has happened for the actual disease, despite the fact that we do have data that could be useful for that, and the government does have data on that.
So your webinar is going to be taking place at 1:00, scheduled to end at 2:00. What are some of the things that people can expect in attendance of this webinar?
Well, I'm going to be asking panelists to discuss their views on a number of things. One is about modeling and whether people think that it's gotten out of control, that it's being correctly used. One is about whether data is, enough or too much data is available at the moment, or what's going on with that, whether it's really helped us, whether we've been any better off in this pandemic than we were, for example, for the Asian flu in the 1950s, which is the last major thing. And why really our data sciences don't seem to have really helped us in this crucial moment to make good predictions, because that is, for me personally, quite interesting. We've had papers being published on machine learning and on data science, and one of the big things is that they're supposed to allow us to make quick predictions where humans can't do that, where the information is noisy and incomplete. Completely silent. Machine learning publications on the spread of COVID-19 have been absent, and I'm not a machine learning expert, but I will be talking to somebody from Google DeepMind. I'll be talking to someone from our Faculty of Engineering. I'll be talking to somebody who teaches biostatistics and epidemiology at Tufts in America, and I'm going to put some of those questions to them.
Oh, sounds fantastic. So who should then be in attendance of this webinar?
Everybody.
Okay. Everybody
who can. I think it's useful. I mean, we do live in an age where, there's a lot of information. That means a lot of misinformation. And it's very, very important and useful in a democracy that people understand science, because people ultimately strongly influence policy. Politicians are, often know better than the rest of us at understanding science, and data science, data analysis is now a crucial part of how we, particularly in the public health context, approach science. If you don't understand something about data, and you don't understand something about its relationship with expertise, for example, then it's going to be very hard for you to make informed judgments about these sorts of situations.
Absolutely, especially because now during this pandemic, a lot of people are under the impression that the use of data is really not, important to them in specific fields, and that
Mm.
things will actually go back to normal as opposed to adapting to the changes that we might face post COVID-19. Now, with the use of data, what do you think will be some of the changes that we might face after this pandemic?
It's very hard to say. One thing about people is that I asked a similar question to a senior epidemiologist, and he said, look, in a few years' time, we'll all have forgotten about it. And I think there's a lot of truth to that. People, historians talk about two kinds of end to a pandemic. There's the biological end and there's the social end. The social end is when people just normalize it. And that will come at some stage. It always seems in the moment that it's not there, but at some point we just lose interest. You look at the lockdowns that are being eased in Africa and also in America. Infection rates are still going up, but people are just kind of over it. It's hard to see any other reason than that. In Europe and in Asia, the rates of infection are declining, and the epidemic is over in a biological sense. Here, not, but we're still looking at a social end. So I think that people will normalize. We have an incredible ability as humans to normalize in our psychology. I do think there'll be some major differences. I do, for example, think that this kind of thing will become much more common, face-to-face interactions. It's been great for me organizing these webinars. I can access people all over the world. If I organized these a year ago, I would have not been able to do that because they'd have been expected to be physically here. So from a global South perspective, I think it's fantastic because it enables us to connect globally. But aside from that, I think there'll be some material changes, but we'll probably feel roughly the same.
Absolutely. Professor, without taking away from what you will be discussing at today's webinar, just briefly to find out how you have been coping under the circumstances that we have found ourselves in.
Well, I still have to work because I can work from home. I have to deal with children under my feet, and that's sometimes a bit tricky. I put a lock on my study door. I'm obviously lucky in that I live in a nice house, and it's not actually particularly unpleasant for me to lock down. I'm aware that for many people, that's just, it's actually a very unpleasant situation. But if you live in the suburbs in a decent house, it's really, and you're the kind of person who can work from home. I mean, you're one of the lucky ones, and I'm lucky enough to be in that boat. But I'm very aware that many people are not. So, it's a little strange. The children get bored. They're home from school. But for me, after the initial, reaction, it's almost working as normal. In fact, I've been probably rather more busy than usual because I've been involved in lots of this COVID-19 stuff and trying to set up this new institute. So for me personally, it's quite nice. But I realize that for many, many people, it's really not.
That's very true. But what are you then looking forward to post COVID-19?
Well, it'll be nice to go for a run. It'll be nice to send the kids off to school. There's that. I think many parents feel that way. It is quite something to have to, especially if you've got to try and work. But also, I mean, if you've lost your job and you've got kids at home, I mean, that's also awful. I mean, so I think a lot of parents are struggling with that, and that's a major thing. I'm looking forward to be able to go for a run. It's a tricky thing. I mean, I'm a little irritated about the face mask thing because beards and face masks don't go together.
Don't connect.
Not comfortable. So that may have to go. But it's going to be nice to have a slightly more relaxed atmosphere. But mostly, I'm just looking forward to the mood in the country becoming a little more easy. I very much hope.
Absolutely. Absolutely, Professor. Without stealing any more of your time, I'd just like to thank you for taking time out to speak to us. And we look forward to the discussion that you will be having in today's webinar.
Thank you so much. That was great fun. Thank you.
Thank you. All right, everyone, just remember that the webinar will be taking place between 1 and 2. We will be posting the link on our social media pages. So make sure that you are in attendance just to find out how data and all of that will be affecting you post-COVID-19. All right, thanks. Bye, Professor. Bye, everyone.
Bye-bye.
UJFM, in the forefront of global excellence. UJFM, shaping the future.